Go.
Go. Okay, so to start, we're going to do 3 muscle tests and make sure the patient's arms are at their side. First, for glute medius, which you're going to adjust the cuboid if there's a problem. So we're going to take the patient's legs, take one out off the table, drop it about an inch, internally rotate, and then I'm going to push in. Tyler, I don't want you to resist my pushing when I say push. And push. Okay, that's good. So that was for glute med. For the psoas, what you're going to do is you're going to take the patient's leg, up 45 degrees, out 45 degrees, externally rotate. You're going to reach across, going to put my hand in your ASIS, stabilize, and then the patient's going to push in and up as I push down and out, and push. Perfect. And that one, if there's a problem, you would adjust the navicular. For the quads, what we're going to have you do is bring up both of your legs, Tyler. With my superior arm, I'm going to reach under lower part of the thigh, and then what I'm going to do is as I push down, he's going to resist by pushing up. Make sure I bring back my head so it doesn't kick me in the face. Tyler, 1, 2, 3, push. Perfect. Now, if there's a problem with that one, then you would adjust the met heads. Now for the adjustments, we're going to start with the navicular. So I'll take the patient's leg, stabilize with my lateral hand, and with my medial hand, with thenar eminence, I'm just going to slide down to where the navicular is, just making sure we find it sinks right in. And then what I'm going to do, just my line of drive, it's going to be superior lateral, just like this, little thrust. Okay. The next we're going to do is cuboid. So what I'll do is I will take my medial hand, wrap it around the foot, see what's on the cuboid. Thank you, cameraman. And then I'm going to take my left hand and also put it on top of that, bring the foot off the table in between my legs. I'm going to squeeze together my hands with my thumb, and then I'm also going to bring my legs together, squeezing that tight. I'm going to do a little bit of distraction, and then I would extend my legs. There we go. Bring that together. Next, for the cuneiforms, I'm going to come down to the foot of the table, slide down the patient's shin, just past the malleoli and the talus, wrap around where the navicular is with my superior hand, making sure it's in line with the tibia. And then I'm going to take my inferior hand, do a little bit of a tissue pull around my contact on the cuneiforms, making sure my fingers are in line, making sure my arms are akimbo, and then just a thrust, inferior to superior. Then we're going to do the talus. So in this one, what you're going to do is just inferior to malleoli again, slide down, wrap the hands around each other, don't interlock them on the talus, and then you're going to do just slight eversion, distraction, and then you apply the adjustment. For the calcaneus, what you're going to do is you're going to grab the foot, stabilize with the outer hand, and then like you're shaking someone's hand, reach around, and while stabilizing the calcaneus, do figure 8 and circles, breaking up any adhesions that there are within the foot. Then for the phalanges, what you're going to do is on the patient's toe, just find the joint and putting the fingers on either side of that joint, and then just do distraction at the distal portion. And then for the fibular head, you're gonna, Tyler, I'm gonna have you bring your legs up. First one leg, thank you. I can switch to the other side, it's easier, so you can see it. Okay, so then what you're gonna do is you're gonna take your superior hand, wrap it around until you can no longer see the knuckle. Just behind the, or actually I should find the fibular head better. There's the fibular head, wrap around until you no longer see the knuckle. You're gonna raise the patient's foot about an inch off the ground, all the way until it's tight. And then from there, you're just gonna do a little impulse. And that adjustment is gonna bring the fibular head anteriorly.